Can COVID-19 coronavirus cause hair loss? We all naturally shed hair on a daily basis. It is common for a person to shed 50 to 100 hairs per day. However, sometimes the hair that shed isn't replaced with new hair, eventually leading to hair thinning and bald patches. This is called hair loss. Hair loss is reported in people who have recovered from COVID-19. One of the potential triggers is an acute illness with fever. People who've become ill with COVID-19 often experience fever as one of their symptoms. The average time from COVID-19 symptom onset to noticeable hair loss is around 2 months. Hair loss that's seen following COVID-19 is consistent with a condition called telogen effluvium (TE). Hair typically falls out in large clumps, often while brushing or showering. This affects less than half of the scalp, and lasts for 6 to 9 months. After this period, most people find that the lost hair regrows. Stress is another potential trigger for TE. Certainly, experiencing an illness like COVID-19 can cause both physical and emotional stress. In fact, TE has also been observed in some people due to the stresses of quarantining. What's the mechanism of TE? Hair has different growth phases. TE happens when stress, shock, or trauma causes a large amount of hair to stop growing and enter into the resting, telogen, phase. In the telogen phase, hairs rest for 2 to 3 months before being shed from the scalp, allowing new hair growth. This is why hair loss due to TE happens so long after a triggering event, such as an illness or a highly stressful period. Treatment. Focus on developing a healthy lifestyle. Ensure a nutritious diet, with plenty of protein, fruits, and vegetables. Protein provides the building blocks for hair to grow. Make sure the diet includes plenty of protein-rich foods such as meat, eggs, fish, beans, grains, and nuts. Amino acid lysine may be particularly important for hair growth. Finding ways to manage stress can be helpful in beginning hair regrowth, as can eating a nutrient-rich diet and avoiding smoking. Iron deficiency may be linked to telogen effluvium. Making changes to the diet to include iron-rich foods may help with hair loss. These include red meat, liver, dark green leafy vegetables, beans, and lentils. Supplementation can be considered for a short time, while nutritional status is improved. Try to avoid chemical or heat treatments that could damage the hair. Also avoid heat styling and heat treatment, such as curling or perming the hair. PRP and mesotherapy treatments can also prove to be useful. Minoxidil is an over-the-counter solution that could treat your hair loss, if other remedies don't seem to work. For patients whose hair loss persists, and telogen effluvium is chronic, topical minoxidil can be helpful. Talk to our doctor about your concerns, and potential causes for your hair loss. They can recommend a treatment that's right for you. Call now for consultation on 844-844-4713. Book your appointment now on www.vplanthairclinics.com.